Continuing our series on which type of care is right for you. Good afternoon again, Dr. Allan McCord coming to you. We're going to actually talk today about arthritis and rheumatism and the possibility of what can happen for you if you have that condition. Arthritis, anything itis is referring to inflammation. Inflammation is part of a healing process in our bodies. Acute inflammation can be really helpful, but when it becomes chronic, that it actually becomes a major issue for us. And you'll hear a lot of talk about inflammation. There are certainly prescription drugs that help curtail some of the symptoms of that, and also some manual things, care like massage care, maybe even acupuncture, other types of physical type of care. Certainly chiropractic fits into this as well. That actually can help affect the effects of osteoarthritis and rheumatism or rheumatoid arthritis. And those are two different ones. Typically the ones that we could really help are the osteoarthritis ones, which have to do with your joints in your, primarily your spine, but also in other joints like your shoulders, your elbows, your wrist, maybe your hips, knees, ankles, toes, that kind of thing. But actually what happens is when a joint becomes dysfunctional, the body goes into an attempt to try to heal it, and it creates an inflammation. And again, that's perfectly okay if there's been an acute trauma or damage. The problem is if it becomes a long-term effect. And so what we're able to do chiropractically is help restore the normal joint function, and that can lead to certainly slowing the effects of arthritis and stopping it and even reversing it. And I'm going to break away to a cutaway that we're going to actually talk about an actual case study here in our office of a 70-year-old gentleman who was actually our oldest and longest living patient. He died just a couple of years ago at 97, and tributes a lot of his ability to function later in his life to the fact that we were providing this care for him. And you'll see this contrast between the pre-view, the before view, and the after view. So we have here two different views of the side of this gentleman's neck who was a patient at our office. The one here on the left, you see this advanced decay. Up in the upper part of the neck looks like it's perfect, like he was when he was 25. He happened to be at this time in his early 70s, and you can see the advanced decay. We call this a phase 3, phase 4, subluxation degeneration decay. He became a lifestyle practice member here at our office, and 13 years later we took another view, and it shows that the disc that was obliterated here on the earlier view 13 years later looks like it's coming back. This actual view looks like it's 20 years younger than this view here. So we actually, based on the advance of the decay, actually took his life back about 30 years earlier than what this view was initially. But this is a sign that shows that chiropractic care, regular chiropractic lifestyle care, can actually help reverse osteoarthritis and decay in your spine. Though that was actually a great illustration of before and after care and how chiropractic care can literally help to reverse the effects of osteoarthritis. In medicine, usually there's just attempts to try to deal with the symptoms. What we do in chiropractic, particularly in our office, is we literally try to affect the change of that joint, increasing the ability of it to function, lessening the impact of these arthritic effects that can be everything from pain, swelling, soreness, stiffness, achiness, those kinds of things. Even waking up in the morning, a typical symptom is waking up in the morning being stiff for the first half hour before you start to move around, or as you start to move around. So those are the things that we can do here. Make sure you tune into the rest of the whole entire series on what type of care is right for you. Thanks for joining us. Dr. Allan McCord, Kent Chiropractic.